Breathe in as much as you can. Keep going as much as you can, and then let it all out. Keep going, keep going, keep going, keep going. That breath you just took is called the total lung capacity, and it demonstrates the biggest volume of air that you can hold in your lungs at any given time. We don't breathe like that normally, do we? We take what respiratory therapists call a tidal volume breath. And tidal breathing is this comfortable, easy breathing that you're doing right now without even thinking about it. One of my tasks as a respiratory therapist is to decide what size tidal breath is most comfortable for my patient when they're on a ventilator. You might have heard of ventilators on the news. They're machines that push air into someone's lungs when they can't breathe on their own. And every ventilator is managed by a respiratory therapist. We call them RTs for short. An RT will tell the ventilator what size breath to give the patient, how often to breathe, and there are all sorts of other settings that we can put into the machine to make the patient as comfortable as possible. But that's not all there is to it. When that air gets down into your lungs, oxygen needs to go from the air into your bloodstream, and the waste product, called carbon dioxide, will go from your bloodstream into your lungs so you can exhale it out into the air. That whole process we call gas exchange. And respiratory therapists are very, very focused on how well their patients can carry out gas exchange. That's just a little bit of the science behind what we do. Working as an RT, you'll need lots of science knowledge and hands-on skills to be able to carry out your job. That makes up about half of our education. The other half is critical thinking and compassion for our patients. RTs will work in every area of the hospital, from the emergency department to the general care floors to the intensive care units, even in the delivery room helping newborn babies breathe for the first time. You'll work with patients from every walk of life and every stage of life, from newborns taking their very first breath on their very first day to the elderly who might be taking their very last breath on their very last day. There's a lot of variety in what we do, and no 2 days will ever look the same for you. Some of the hands-on skills that you'll need as a respiratory therapist include drawing blood from your patients, giving inhalers and other breathing treatments, setting up and managing ventilators and other sophisticated equipment, and even putting a tube down someone's throat to connect to that ventilator, again, to help them breathe. We work as part of the healthcare team, working right alongside of physicians and nurses and other healthcare specialists to take care of our patients and make them healthy again. For several years, I worked as an RT at a children's hospital. My favorite thing to do when I was there was fly in helicopters. We would fly to other hospitals and pick up really sick patients and bring them back to our hospital to better take care of them. You need to be able to think on your feet when you're up in the air and you have limited resources and a very, very sick patient. RTs will become experts in critical thinking and problem-solving skills because we use those activities every single day. Some therapists will work in one hospital. Some therapists will work in a hospital system where they might move from one institution to another each day. Another therapist might work for a travel agency. When you're a travel RT, you get to travel the country taking small contracts at various hospitals that are understaffed. This way you can really grow your skills and you get to see the whole country in the process. If that's not quite your speed, you can also work what we call a contingent or per diem job, where you can work as many shifts or as few shifts as you like. Having a lot of variety is really one of the things that drew me to respiratory care. RTs can work other places besides just the hospital. Some will work in diagnostic labs, some will work in rehab facilities or sleep study labs, some will even work in physician offices teaching patients about their lung disease and how to best take their medications. Some respiratory therapists will move on to leadership roles. Some therapists have even become CEOs of hospitals or high administrators at universities. There's no limit to where you can go with your degree. If you're more into the equipment side of things, some respiratory therapists will work for sales companies selling the ventilators that were built, teaching people how to use those ventilators. Some will even work alongside biomedical engineers designing new ventilators themselves. Some people like me will go on to become college professors teaching the next generation of respiratory therapists how to become an RT. You might be wondering what schooling would look like. First, you'll need to have a college degree in order to work as a respiratory therapist. While you can work on an associate's degree, there's a big push across the industry for everyone to have a bachelor's when you start out. I teach at the University of Toledo, and this is what our program looks like. You'll spend about 4 years in school and you'll have a bachelor's degree when you're done. The first 2 years, you'll spend taking general education courses and prerequisites. That'll be things like your math classes, writing classes, anatomy and physiology, chemistry, and biology. Once you get that foundational education, you can move into the professional program, which is the last 2 years of schooling. In the professional program, you'll spend 2 days a week in the classroom with professors and 2 days a week in the hospitals learning at the bedside with real respiratory therapists with real patients. My students will have about 1,000 hours of bedside experience by the time they graduate. Once you're done, you'll need to pass a board exam, which shows that you have the knowledge and skills required to call yourself a registered respiratory therapist, or an RRT. From there, you can get a license to practice respiratory care in your state and go on to get one of those many job opportunities I talked about. Now, some places like Ohio, where I teach, you can start working as a student respiratory therapist before you've even graduated. They make about $19 an hour, and they're able to put their knowledge and skills to use right away. Once you've graduated and you're a registered respiratory therapist, you can start out making about $60,000 a year. If you think a career in respiratory therapy is right for you, I encourage you to check out all the resources available on bnrt.org.